Okay, guys, chapter 11. Let's talk substance abuse. So, when we talk about substances, I am talking about drugs, but instead of using the term drugs, and the reason why we're not using drugs is because for some reason, when we think drugs, we think the illicit street drugs, right? We think like heroin, cocaine, methamphetamine, that kind of stuff. Um, I want to make sure that we are including in our discussion all the substances, including non-illicit street drugs like stuff prescribed by the doctor, and also stuff that's not even controlled at all, like say, I don't know, your caffeine in the morning, your coffee, or your nicotine in your vape or your cigarette. So we talk about substance abuse. We're talking about something that is incredibly impactful to our country, both financially and socially. Um, Dependence alone is responsible for the destruction of so many families and flat out death. You guys know in my previous life I was a law enforcement officer, and I cannot tell you how many people's lives I've seen ruined through substance dependence. And I'm not talking about by the criminal justice system. I'm not talking about through prosecution, arrest, or those kind of things. I just mean just through financial wasting away, through physical wasting away, through health problems, through death, through neglecting family members, getting child welfare services involved in your life. It's just, it can be really bad. So it does warrant talking about it. It also warrants explaining what it has to do with psychology, because there's some debate out there as to whether or not substance abuse counts as a disorder or disease. I think a lot of that has to do with the fact that in many cases, substance abuse is something that was, at least at some point, brought on through choices made by the patient or the subject. And that may or may not be true. But the relative criminality of the action is not the focus of our discussion here. It's whether or not it's disordered activity. And it is, in fact, disordered. It is definitely contrary to the person's well-being, and it definitely has a very negative effect on their life. So it is classified as a disorder in the DSM-5, and it does require psychological treatment. Um, you know, Kicking a substance dependence problem is very rarely successful on your own. It is almost always requires, especially with the more serious dependence profiles, it requires psychological intervention, therapy, in addition to medication and chemical intervention as well in many cases. So, all right, let's get down to it. So this is not going to be a dare class. We're not going to do we're not doing stay off drugs here. Just say no. That's not the point here. By this point in your life, you should have already made some decision as to where you want to go with your use of different substances and those sorts of things. But what I'm here to do is give you the facts about certain substances and how they are abused and how those work in the field of abnormal psychology. Okay, so first thing we want to do is we want to separate the four terms: use, intoxication, abuse, and dependence. Okay, use is just what it sounds like. It's use. You drink a cup of coffee, you have used caffeine. You smoke a cigarette or vape, you have used nicotine. You inject heroin, you have used heroin. Please don't inject heroin. But so it's just the use. And the use happens separate from the intoxication. And this makes sense, right? You know that. You can use alcohol without becoming intoxicated on alcohol. I'm sure everyone here can drink a beer or a drink and not become intoxicated. Or if you can't, then you can't. And that's actually a really good point, because intoxication has a lot to do with your body's metabolism, your body weight, how much fat you have, how much muscle you have. Other factors go into it, your overall health, brain chemistry, all sorts of things. So intoxication is largely a individual thing. So people say, well, how many glasses of this does it take to get drunk? Or how many hits on a joint can I take before I'm high? Or how much of this or how much of that? Well, that really all depends on you, buddy. So that's something you should understand. So when we talk about use, we're talking about just the use of it. Intoxication is when your use of something has caused enough chemical changes in your body that it is now affecting you at either a cognitive, a physical, or a psychological level, and it is causing a change to one of those functionings, or at least a perceptible change. So we're all familiar with the 0.08 BAC, blood alcohol content level, for driving, right? We all know that that's when you're technically DUI, driving under the influence, at a 0.08. That is because kind of nationally, the law and science got together and said, this is about the blood concentration level where we start to see cognitive impairment, we start to see physical reaction time impairment, and those kind of things where driving becomes dangerous. That may be true, but the reality of it is the first drop of ethyl alcohol that hits your system starts affecting you systemically and begins dampening your cognitive ability and dampening your CNS reaction time. So, and it's almost imperceptible at that point, but we can look at it at the neurological level and see the impact from the very beginning. But we're not saying that's intoxication because it's not at the perceptible level. Okay. So, for different people, intoxication occurs at different levels. And most substances have a tolerance ratio where the more you use of them, the higher your tolerance is going to be before you hit that intoxication level. So the intoxication index, or the point of intoxication, goes up the more you use a substance. Okay, we understand that. What doesn't go up is the lethal dose index. So many of these substances have what's called a lethal dose, which you may know as overdose. The LDI, or lethal dose index, is the point at which your body will now suffer medical problems due to the use of the drug. And the lethal dose index is where it kills you. Overdose is where you start to suffer medical problems. So the overdose index and the lethal dose index, they don't move. But the tolerance level for intoxication does. And so this is what you'll see when you see someone who is a longtime alcoholic. They drink tons before they show any signs of being drunk, right? But the damage to their liver is still the damage to their liver. And when we talk about how the drinking is going to kill them, it really is, because at some point while they're chasing that level of intoxication, they're going to reach the point where their body can't handle the level of poison in it anymore. So use, intoxication, abuse. Abuse is when we use something to the point that it is interfering with our functioning in our life. So that can be on a one-time basis. If you use alcohol to the point of intoxication and then get in your car and drive, you have abused alcohol because you've made a very bad choice to operate a vehicle, and now you're a threat to yourself and everybody else on the road. Right? So that would be abuse. More commonly, when we refer to abuse, we're talking about it on a long-term scale, where someone's use of a substance interferes with their ability to function in real life on a day-to-day basis. For instance, somebody who is addicted to alcohol or addicted to a particular drug to the point where they have to use it while they're at work, or where they can't stop thinking about it when they should be doing other things, or they cannot stop spending money on it when they don't have the money to spend, or when they make choices to do things like go to the bar instead of pick up their kids from school, or whatever. I mean, we can come up with a million terrible things that people do for substances. So we would consider that a pattern of abuse of the substance. And in the case of prescription medication, it's going to be taking it outside of the prescription. Right? The doctor has given you a drug and has said you will take it this way, and the second you stop taking it this way, or you take it some other way, you are abusing the drug by definition. Dependence. Okay. Dependence is when you have engaged in a pattern of abuse to the point where you have tricked your body's brain chemistry into thinking that you need this substance to survive. Dependence occurs at different levels. It's not a spectrum, but it does occur at different levels for different substances. For instance, caffeine dependence is relatively common in the United States, and it's even accepted, right? Don't talk to me before my coffee, right? We make jokes about it, right? But why don't we talk to you before your coffee? Because you have tricked your brain into believing that you absolutely must have that caffeine to function, to the point where you cannot function without it. So when you get up in the morning, you have altered mood, you have altered cognition, you have altered biophysical responses to things. You're a wreck, right? And then if you go for extended periods without the caffeine, you start to get headaches, and you don't feel good, right? You get grumpy, right? These are all signs of withdrawal. So then we get you your coffee, and you feel better, and now we can talk to you because you've had your coffee. And we accept that, right? That is a substance that we accept both the abuse and the dependence on. On the other hand, sometimes substance dependence can be life-threatening. Alcohol. Alcohol abuse is incredibly common in several different classifications of life. College students, police officers, firefighters, actually all emergency responders, military veterans. It's just alcohol abuse is super, super common in all different walks of life, and it's for different reasons. Sometimes it's being used as a depressant, as an escape. Sometimes it's being used as kind of a party lubricant, to increase fun and lower inhibition. But its abuse is very, very common. Okay, you would be hard pressed to find somebody my age who's not abused alcohol at least once in their life, and definitely who has not been intoxicated. They're out there. It's true. But dependence is a totally different thing. Dependence on alcohol means that your body believes it needs that ethyl alcohol to survive. And the truth of the matter is, at that point, it actually does. Withdrawal from alcohol. Withdrawal is the negative symptoms you get when you do not feed the body the drug that it's dependent on. Withdrawal from alcohol is a life-threatening situation. When somebody is arrested and they tell the arresting officer, "Hey, look, I'm an alcoholic, and I'm going to go into DTs, delirium tremens." It's a kind of an older term for alcohol withdrawal. I'm going to go into alcohol withdrawal. We got to get them to the hospital, because when they go into that withdrawal, they're going to have seizures, they're going to have hallucinations, they're going to get psychotic. They're not going to recognize what's going on in them in reality. They're going to go into shock, and there's a good chance their heart could just stop on them. Okay, and it lasts for a long time. Opiate withdrawal too is equally dangerous and just awful. I remember back when I was a young police officer on the street, if I arrested someone who was addicted to heroin, which is an opiate that you inject, and I would ask them, "Okay, how long do we have till you get sick?" Say, "Oh, about 20 minutes, officer." That means in about 20 minutes, this person is going to be in the throes of a life-threatening illness. They're going to be vomiting, they're going to be shaking, they're going to be hallucinating, just like the alcohol withdrawals. Their body is either going to be burning up with temperature or going hypothermic, and their temperature is going to be dropping ridiculously. There's a good chance their heart could die, they could have a stroke, they could have an aneurysm. In 15 minutes, we got to get you somewhere, right? And imagine now that you're dependent on this drug, right? You can't just go to the store and buy it. It's illegal, right? But in every 15 to 30 minutes, this is going to start for you. And it runs the risk of killing you. So you need to get a hold of this drug. So your choices are, you can either buy it, and it's expensive on the street illegally and risk going to jail, or you can check yourself into a treatment program, and hopefully you have the ability to pay for that, and it's covered by your insurance or anything, because otherwise it's incredibly expensive. Most people, of course, can't afford that. We're not movie stars. And so they go the route of trying to acquire the drug. And what does that lead them to? Criminal activity, right? They have to break into cars. They steal the change out of the center console. They're ripping off catalytic converters. They're engaged in other criminal activity. You're ripping stuff off and selling it for the drugs. Sometimes they're selling their body for the drugs. They're doing whatever they can do to acquire the drugs, because every 15 minutes they need the drugs. Otherwise, they are going to risk dying. Okay, or at the very least being so miserable they wish they were dead. So you can see how a pattern of dependence can destroy a family. Someone who's dependent on a drug like heroin will psychologically come to a point where that is the most important thing in the world. There used to be um, a commercial for an asthma medication called Primatene Mist. I don't even know if they make this stuff anymore, but um, the gist of the commercial was it showed somebody having an asthma attack, and then they would spray this Primatene Mist in their throat, and the bronchial tubes would open up and they could breathe. And the tagline for it was, "When you can't breathe, nothing else matters." And that actually is a really good point. Because you may love your family, you may love your dog, you may love your kids, you may love whatever, but when you can't breathe, it's really hard to think about things other than the fact that you can't breathe. Um, and when people go into these withdrawal symptoms, it becomes all encompassing. You stop being concerned about your family, stop being concerned about your wife, your husband, your lover, your whatever. You stop caring about these things. You stop caring about your kids. You stop caring about feeding your kids. All you care about is making this terrible feeling go away and not dying. So dependence can be life threatening, definitely life changing. I myself have gone through a chemical dependence to a legally prescribed drug. I had a medicine that I had to take for several years. It did not even come with the benefit of an intoxication. There was no high associated with it. It was an endocrine medication, but it had a severe dependence syndrome. And when it was time for me to get off the medication, the doctor warned me, this is going to really suck. And I thought, well, I'm a tough guy. I'm an ex-cop. I've had all sorts of training. I've been, and I've been in combat before and everything. And oh my God, you know, we're talking laying in the bed, shaking, trembling, awful, awful crap. I was never in risk of dying. It wasn't as bad as heroin or anything like that, but it's bad. It was bad. And I got to see kind of firsthand what it's like for people with chemical dependencies. So don't discount dependence as just, oh, it's his fault, he created it, because a lot of people have become dependent to the drug and don't want to be on the drug anymore. They used it. Some drugs are incredibly addictive. First, second dose you use it, you create an addiction. So yeah, they made a bad choice. Now they would like to not use it anymore, and they just can't stop. And we need to figure out how to help them. By the way, treatment for these things usually comes in the form of both medical and psychological treatment, because you have to treat the psychological processes that drove them to use the drug in the first place. Not everybody gets addicted, right? Some drugs you're going to get addicted no matter what, but not everybody gets addicted to everything. Not everybody has what we call the addictive personality. And what the addictive personality is usually there's a void or a need that the person is trying to fill, or something they're trying to escape. A lot of PTSD patients use alcohol as kind of a self-medication to try and dull the anxiety, help with sleep, and do these things. And its base, it sounds like, oh, that sounds a good idea. The problem is alcohol actually raises anxiety once it wears off, and it impedes sleep. So you end up with people with post-traumatic stress disorder who are also addicted to alcohol, or you end up with somebody with a clinical depression who is also addicted to an opiate, somebody with bipolar who is also addicted to methamphetamine. As you may imagine, adding dependence to an existing psychological problem is not very good for the psychological problem. Okay. All right. So let's talk about the different classifications of drugs. So the cannabinoids. The cannabinoids is where marijuana comes from. It comes from the cannabis sativa plant, and you may think you know all about it by this point, but there's probably some stuff you don't know. Like, for instance, did you know that the intoxicating chemical in the cannabis sativa plant, which you call THC, is actually tetrahydrocannabinol delta 9? Now, you say tetrahydrocannabinol delta 9 at a party, and people will think you're smart. But that's the only part of the cannabis sativa plant that's intoxicating. The rest of it is all inert, including CBD. There's a lot of politics and law surrounding, there's a lot of politics and law surrounding cannabis itself, and we're not going to get into that. That's not the scope of this class. It is interesting to research and look at the process by which some of these drugs became government controlled and illegal, and others did not become illegal. And I invite you to research that on your own. But but just for the purpose of this class, it's the THC, the tetrahydrocannabinol delta 9 that creates the intoxicating effect. It is not it is not CBD. It's not any other part of the plant. So, part of the problem with cannabis in the United States is back in the 50s, the government lied to the American public as a whole. They created this documentary, and you may have seen it, called Reefer Madness. And this was supposed to be a PSA to warn people of the dangers of using marijuana. The problem is, it was a complete lie. They totally made crap up. They said stuff that wasn't true, and people saw through it. And I'll give you the gist of it. Basically, it follows two people, a male and a female, and they're both, valedictorian, good kids on their way to college and to, rule the world and stuff. And they smoke weed once, and now they're sex crazed lunatics and they're murderers. Seriously, the guy becomes like Michael Myers. It's hilarious. Okay. And they actually made musicals and all sorts of stuff like, because it's so bad. The problem is, when your government lies to you at that level, you don't believe anything else they say. And so this gave rise to kind of the drug culture in the 60s. They're like, well, if they're full of crap about that, maybe we can be full of crap about all sorts of other stuff. Right. And so when they come along, like, no, this one really is dangerous. Well, tough to earn that trust back. So, cannabis is what we call a CNS depressant. CNS, central nervous system. That's your heart. It's your sweat. It's your pupil dilation. It's your central nervous system. It's all the nerves and then the core of your body and everything you do, your motor skills, everything. It's a central nervous system depressant, which means it slows everything down, right? And when you see somebody under the influence of a central nervous system depressant, you'll see you'll see effects on their pupil dilation. The pupils tend to constrict. Their heart rate slows down. The speech slows down and gets slurred and thick, depending on the level of use that they're experiencing and the intensity of the substance. They can go all the way into unconsciousness, or just have severe cognitive impairment, and slow, thick thoughts and those kind of things. Just a quick caveat about cannabis. The THC levels back in the Reefer Madness days were nowhere near the THC levels of the stuff that's on the market today that people are buying and using. So when we talk about cannabis, it does not have a lethal dose index. When we talk about it, it does not have any dependence syndrome whatsoever. That research is all based on a much lower dose of THC. It's not based on modern THC. Now, that being said, we still don't have a lethal dose index for cannabis. And we are now starting to explore the possibility of a psychological dependence. But the jury is still way out on that. So as far as lethal dose, it still does not seem possible to overdose or die on cannabis. That being said, when Shaggy sitting next to you tells you it's totally safe because it comes from the earth, well, so does arsenic. Okay, so does, and it's natural. Well, so is tobacco, and it is certainly not a deadly chemical like methamphetamine is. That would be lying to you if I said it was. But anytime you light something on fire and inhale that smoke, it's not good for your lungs. I know there's a million ways that you can ingest cannabis. I'm just telling you, smoking. There's no point in anywhere anybody is going to be honestly telling you that smoking something is good for you. It's never good for you. So find the truth between both ends of the spectrum. Stimulants, central nervous system stimulants. These are things that speed you up. They speed up the heart rate. They speed up they cause serotonin releases in the brain. They cause dopamine releases in the brain. These tend to create feelings of euphoria and excitement and energy and in some cases, a false psychotic state. So when we see people using central nervous system stimulants, we see their heart rate speed up, we see their pulse speed up, their blood pressure goes up. It's like they just ran a mile, right? These come in different levels, right? Caffeine is a central nervous system stimulant, pretty mild compared to some of the other ones, right? It does raise the heart rate. We say it wakes you up, gives you energy, does these things. Well, what it's really doing is tricking your body into a false excited state. And it does have a mild norepinephrine release in the brain, which creates mild feelings and sensations of happiness. On the other end of the spectrum, we have drugs like methamphetamine, what we call here in Hawaii ice, what we call back in California, we just call it meth. I think that's what they call it everywhere else in the world. Either way, it's the same stuff. And meth is bad. There's no redeeming quality to methamphetamine. It is made from chemicals that individually are all poisons. It is made in a way that is poisonous. It is made in a way that is so dangerous that very often, at least on the mainland, the labs will blow up and take out city blocks with them. They are so dangerous that when we would go into a house, if we found a meth lab, we would have to shut down the block, call in a hazmat team. All of us would have to literally burn our uniforms and get scrubbed down naked in the middle of the street. This stuff is super bad. Okay, there's nothing good about it. Again, I said I wouldn't be doing a PSA for don't do drugs, but if it's something you're thinking about, I'm going to just tell you right now, don't. Okay. As far as dependent syndromes go, it is incredibly, incredibly addictive. It creates a dependence very, very rapidly. And being addicted to something that is this much of a poison is not good because it systemically affects the body. That means it affects every organ and process in the body. It kills everything from kill the liver to kill the skin. You can tell people who abuse meth because they very rarely have all their teeth because it actually causes dental decay. They generally have lesions in their nose, burns that go between the septum and their nose. They have skin lesions where the skin has literally opened up and started to blister. The skin takes on this waxy yellow color. And they have this smell of ammonia, almost like urine, about them. It's because it's leaking out of their pores. It is 100% poison. But what it does inside the body, I mean, you got to think about it. Why the hell would you turn yourself into a zombie? Like literally, you look like a zombie, right? Why would you do that to yourself? Well, remember way back when we were talking about neurosynapse connections and how one nerve will release this chemical and it'll bounce around and hit the other nerve, and that's what makes you feel happy or sad. And then we have some medicines that can create more of that chemical out there if there's not enough of it to ease depression and those kind of things. Remember we talked about that? Well, what methamphetamine does is it causes a flood of that chemical of serotonin and dopamine to go into that neurosynapse gap, causing you to have this incredibly intense euphoria and mania, right? Heart rate goes through the roof. Brain waves go through the roof. Everything goes up through the roof. You know, we joke about people who use meth. You know, we talk about them like taking apart their toaster at 3 a.m. But it's true. They'll go for days without sleeping. Right? They'll go for days without sleeping. They enter an almost psychotic mania state where they are so happy and so energized. They feel like they can literally do anything. They could even fly. They speak so to their brain, they think they're making sense, but they're speaking and going so fast that it's just word mash coming out of their mouth. Does this sound like anything you've heard before? It sounds like the manic phase in bipolar, right? Because that is literally what they're doing. They're inducing a manic phase. It's the same chemical processes that are going on, but they're just causing it in themselves. And when we talk about somebody in a manic phase, we say they're a danger to themselves and possibly other people because they don't know they can't fly. Right? They think they're bulletproof. They think they can spend all the money in the world. They engage in risky sexual behavior. They'll run out into traffic naked because they think it's okay. Right? We talk about somebody in a manic phase. Well, you're inducing it, right? And it feels good on the inside. That's why people do it. But on the outside, the manifestation of that feeling is pretty dangerous. The problem is when they induce this manic phase, the body says, whoa, we got way too much of this chemical bouncing around in here. We're going to shut off our natural production of the chemical because we got it coming from somewhere. So we got to shut off. So the body turns it off. When the drug wears off and the chemical goes away and the body has shut down its production, you come down lower than you were when you started. What does that sound like? That's the depressive phase. So they go from a manic phase into a depressive phase. And now they are in a lower state, in a psychologically depressed state where they're at risk for suicide. They're at risk for violent behavior. They're at risk for all sorts of, all the stuff that comes with major clinical depression, right? And they have to use the methamphetamine to get back up again, but they will never get back up as high as they were before. They came up here, they went down, now they're here, and now they're down, and now they're here, and now they're down, and the line keeps going down. And that downward trajectory represents the tolerance you build up to drugs like methamphetamine. And methamphetamine, you build up a tolerance very, very quick. The lethal dose of meth isn't very high. You build up tolerance very, very quick. What does that mean? That means it's dangerous because at some point you will stop getting the reaction you're looking for and you'll just kill yourself. At any given time, using methamphetamine can be lethal. Because it can cause your heart to explode. It can cause brain aneurysms. It causes all sorts of things. One of the tests we used to do to see if somebody was under the influence of a central nervous system stimulant like methamphetamine is you have them close their eyes and count to 30. Seriously, I would tell people, the field sobriety test, we have people look at our fingers. There's also tests for the drugs. And I would tell them, okay, close your eyes, tilt your head back, count to 30, say done when you're done. And I swear to you, people would do this. 30, just like that. And they swear to God, they counted like super long. They're trying super hard. It's crazy. You can look up the videos on YouTube online. Also a stimulant, cocaine. Now, cocaine, unlike meth, actually started out as a medication. No, it was never in bottles of Coca-Cola. That's a myth. The coca leaf was in there, which is where cocaine comes from. Cocaine started out with a medical purpose. It was used as a dental analgesic to numb your mouth during dental surgery. But people, of course, started to abuse it, and they discovered that it could be used as a central nervous system stimulant. Similar to meth, it creates feelings of euphoria. It creates feelings of happiness, a kind of a mania, not as high, not as sharp as meth. And the high or the intoxication from cocaine doesn't last as long as methamphetamine. It comes back down. Cocaine is responsible for the drug war that started in the 80s in the United States. For better or for worse, for good or bad, this is where the cartels, the drug trafficking, and the United States law enforcement response and the criminalization of drugs really started. When we hear politicians, people talk about there's too many people locked up for usage of drugs or just possession of drugs. This is kind of where that all started because their idea was to punish. Cocaine. Cocaine was one of the most insidious drugs, especially to the African American urban community, because when it came to that community, they discovered how to turn it into rock or crack cocaine. And that became the drug of choice in many African American urban communities. And it just devastated those communities financially, socially, criminally. And you see the rise of the street gangs like the Bloods and the Crips selling this drug. Super, super addictive, super, super dependent. And to this day, even though crack has kind of gone the way of the dodo, you still hear the term, the guy's acting like a crackhead. Well, there's a reason, because that's kind of how people on crack would act. And it's certainly not a drug limited to that race, but that's where we saw the introduction of it, and it exploded as a population, became a real problem for those demographics. The powdered version of cocaine was a problem in the white community, and I don't really know why one went one way, one went the other way, because at the end of the day, they were devastating to both communities. They're just awful. So those are central nervous system stimulants. Other stimulants, caffeine, nicotine, also what you have in your cigarette or your vape, also a stimulant. No lethal dose index for caffeine or nicotine. You can overdose on caffeine though. You can give yourself the jitters, give yourself a headache, that kind of stuff. All right. Depressants, exact opposite of stimulants. So the depressants, the CNS depressants, work to slow the system down. They slow everything down up to and including the point of absolute unconsciousness and or death. Many drugs aren't necessarily strictly depressants, but they have depressant activity. So things like Xanax, Vicodin, which is actually an opiate. So what we call, and you don't need to know all this stuff, but we call hypnotics and psychedelics and these things, they have a depressant effect, just like the stimulants, just in the opposite direction. They slow everything down, and they slow down cognition, and they make it hard for people to think, to reason, to make good judgments. They impair judgments. This is why you see people doing really stupid things when they use a lot of alcohol, things they would never do in real life. Because we say, oh, loosen up and have fun. Well, what's happening is we're lowering their forebrain's ability to cognitively say, hey, this is a bad idea. And again, I'm not demonizing, if somebody has a drink to relax or anything, I'm not saying that at all. But when I'm saying it, when it's abused for the purpose of removing your ability to make good judgment, then we're talking about using the depressant in probably a very bad way. Alcohol is probably the most commonly used depressant in the United States and the world, frankly. Opiates. So opiates have a depressant effect, but they're a special class of drugs. Opiates come from the poppy plant, okay, from the opium plant. Um, and if you watch Game of Thrones or any of these old fantasy series and they talk about somebody who's really injured and they talk about giving them something called milk of the poppy, they're talking about giving them basically opium. So it has had a long history in the United States. It started with opium and then went to a thing called laudanum, which was actually sold as a cure-all in competition with cannabis in the Old West. Addictions to laudanum were frequent, common, and epidemic, but it was actually sanctioned and sold by the U.S. government. Laudanum is nothing more than opium. And then we developed the drug morphine from that, which of course is used as an analgesic to knock people out when they go to sleep, when they go in for surgery. And from that, we also have the painkillers like Vicodin, Oxycontin, and we also have the street drugs like heroin, which can be smoked or injected. So all of these fall into the opiate category. And opiates right now on the national level are probably the most deadly drug in the country. The U.S. Border Patrol made a bust I don't know, it was about a year ago, coming over the border from our southern border on the mainland, and they caught about 5 pounds of fentanyl. That was enough fentanyl to kill every man, woman, and child in the United States. Okay, it's really hard to come across 5 pounds of a substance and have it enough to kill everybody, right? Unless you're talking about like depleted uranium, right? But the problem is these concentrated opiates are incredibly powerful, and it takes very, very, very little of them to achieve the intoxicating effect, and only a very little bit more to kill you. And they are extremely addictive. The problem with the opiate crisis that you may hear about on the mainland isn't necessarily the use of illegal drugs like heroin. It's the abuse of legal drugs like Oxycontin and Vicodin. What happened was when these drugs came out on the market and doctors were prescribing them for pain control, people, good people, normal people, people with no history of any problems ever in their life are suddenly addicted to these drugs. And they're having opiate withdrawals, which I described earlier as being life-threatening, right? And so now they're engaging in activity they never would have engaged in before, and they're losing their homes, they're losing their finances, they're losing their families, they're losing everything, they're going to prison, and because they're doing whatever they can to feed this addiction that they now have that, frankly, was caused through legitimate means. This is a huge problem right now in the medical community. In nursing homes and care facilities, you see our elderly people entering palliative care for their end of life care, and they have fentanyl patches that they're prescribed to put on to ease their chronic pain that they're in as they're moving towards end of life care. And these are being stolen and sold on the street, right? These are being stolen and abused by people. Certainly not all care workers are doing that, but I'm saying that is a big place of where they're coming from. People are going into their mom and dad's medicine cabinet. Hell, their mom and dad are doing it, right? I had a horrible, terrible case with this kid. He was 19 years old. When he was 18, he was a varsity football player at a local high school. He had a scholarship to University of Southern California, the Trojans. He was going to USC on a football scholarship. Got good grades. Nothing wrong with this kid. I mean, this kid had everything going for him. I met him because he was robbing pharmacies. Because in his senior year, in one of his football games, he got speared in the back and it caused a bulging disc back there. He was in severe pain. The doctor prescribed him Oxycontin, an opiate. He became addicted. And next thing you know, this poor kid got his dad's gun and he's robbing pharmacies for the drugs or the money to try and feed this. And, you know, it's funny, when I was talking to him, he's like, I don't even get high when I use it. He goes, I don't feel, it's not for pain relief. It's not to get high. It's just that if I don't have it, I get so sick that I'm afraid I'm going to die, right? Kid's life, good kid, ruined, right? Through drugs that he was prescribed. So opiates are no joke. They are no joke. And if you are prescribed opiates, you would be wise to follow your doctor's instructions and research and understand what it is you're putting in your body. And, you know, this is why I cringe when, I know I'm old, But when I see artists whose entire music platform is built off the use of certain drugs, and all their music is about using bars and dropping Xannies and all these things, I'm like, ooh, that's not weed you're talking about right there. But again, I won't make this a PSA, but I do want you guys to be aware of the danger. Okay, that's all I'm going to say about substance abuse. We're not gonna beat this into the ground too far because we got a lot of material to cover left in the class. All right, guys, thanks for watching. Talk to you soon.